We have Representative Bonner moving House File 1226. Put it before us. And I believe, Representative Bonner, that you have an author's amendment. And so we'll have you move that as well, the DE1, to put it in the shape to which you would like to have it. Any discussion on the author's amendment? Anybody has? And hearing none, all in favor of adoption of the author's amendment, say aye.
Aye.
Any opposed? Okay. So House File 1226 is in the form that Representative Bonner would like it to be. And Representative Bonner, I'll turn things over to you and your testifiers.
Thank you, Mr. Chair, committee members. I wanted to start today with just a little bit about this. We know, for example, that there's, well, I have to be honest with you, I'm pretty excited to be here talking about this today. House File 1226, excuse me, for home visiting services really serves pregnant women, parents, and young children. It makes a really big difference in having these home visiting services and being able to provide sort of a stabilizing support for families that experience high risk factors where they're most comfortable, in their homes and in their communities. And we know that the families that receive these visits from trained professionals and paraprofessionals have access to healthcare services that improve pregnancy and birth outcomes. We know that we have opportunities to develop secure attachment with these children, improving their social, physical, and mental well-being, while improving maternal health and employment rates, as well as building vital connections into the community. With that, I am pretty excited to dive right into this bill today. We do have some testifiers before us today, and I will hand that over so we can get started.
And so we'll have our first testifier introduce yourself, please, and then feel free to begin. And you can state and spell your name for the record.
Chair and members of the committee, for the record, my name is Chandra Bittman. I'm the Director of Families Together at LifeTrack.
And would you mind spelling your name?
Chandra, last name Bittman, Bittmann.
Great, thank you, and please begin.
I'm here today on behalf of LifeTrack and the Minnesota Targeted Home Visiting Coalition. The coalition seeks stable funding statewide for targeted home visiting services and increased support for home visiting as a core early child service. At LifeTrack, we understand that parents play the most important role in their child's early development and learning at home. Our team of home visitors go into the home and provide culturally appropriate services centered around health and well-being, child development, parent education, and parenting support. Many families referred to LifeTrack's home visiting programs come to us for voluntary support after being ineligible or closing out of county-based services such as child protection. With a holistic approach, home visitors both coach and teach the parents the importance of early childhood development and focus on how they can best meet the needs of their families. At the same time, they're assessing the individual needs of the family and providing referrals to other LifeTrack programs or the services of our partner agencies to help stabilize the home. At LifeTrack, we offer both evidence-based and evidence-informed home visiting programs. We offer multiple types of home visiting programs because of the diversity of experiences and situations families present themselves with when we first meet them. Giving families access to different types of home visiting programs allows us to best meet their needs. With additional home visiting funds, programs like LifeTrack may have the opportunity to engage additional families and in our programs. We hope the legislature will continue to invest in home visiting services for families. We know these early investments have positive lifelong impact on families and their children. Thank you.
Thank you very much. And our next testifier, please introduce yourself and state your name for the record, and please begin.
Excuse me. Good morning, committee chairman and members of the committee. My name is Marilyn Herrera, spelled Marielynn, last name Herrera. I am the program manager for New American Families, a home visiting service provided at YWCA Mankato. Our evidence-informed home visiting services specifically supports immigrant and refugee women and their families in Mankato, North Mankato, and St. Peter area. We use an evidence-based curriculum and have a team of trained paraprofessionals that go into the home and provide culturally appropriate same-language services centered around health and well-being, healthy child growth and development, and parent education and support. YWCA Mankato began working alongside immigrant and refugee families in our community to improve school readiness because too often their children were entering kindergarten with fewer skills necessary to support educational attainment. Their barriers to access early childhood education stemmed from their unfamiliarity with how to connect to these opportunities and basic health and wellness services. Specifically, we understood that low-income immigrant and refugee parents confront unique obstacles to ensure their children are prepared for school. These experiences may include severe poverty and limited opportunities in their home country, and the loss of extended family and cultural framework for parenting. In our rural communities, isolation is only magnified among the mothers and families we serve, and transportation access is even more impaired. The structural barriers and limited resources of low-income immigrant parents often results in these parents being the only educational resource for their children. Our approach at YWCA Mankato is a collaboration with mothers that builds on their basic bond with their children to remove barriers to participation in their child's education and development, connect families with local providers to improve family well-being and health, and strengthen their connection to the community. This approach empowers families to expand their contributions within our community, contributing to and creating a more equitable society. We know our home visiting program makes a positive impact in the lives of families we serve, as well as the Mankato area. In written feedback from one of our mothers, she had this to say: "I would like to thank my friend, Reina Thomas, who is our home visitor, for insisting and demonstrating to me the YWCA program. I am thankful to the program for the opportunity to learn more as a mother and for teaching my son more about what he learns in school. I am also thankful to the Museum of Mankato, which is the Southern Minnesota Children's Museum, for giving our family the opportunity to have a space to come together as a family and learn as a family. This highlights important virtues of home visiting. The value of having someone with a similar life experience as your own enables trust and influence to motivate families to use resources. In addition, honoring a parent's wisdom helps them feel effective in their role as parents. Services such as ours can provide tangible connections to community programs and activities that help families build relationships and create valuable memories in their community. We hope the legislature will support funding for home visiting programs so all families can gain the assistance they want and need so they can feel welcomed and supported by their community. Thank you.
Thank you. And then our third testifier.
Good morning.
Thank you. If you can pull the microphone towards you so that you can be picked up. Thank you.
Good morning, Chair and member of the committee. For the record, my name is Nedra Robinson. You spell it Nedrarobinson.
Thank you.
I'm a senior early childhood specialist at Simpson Housing Services. Simpson Housing Services is a nonprofit providing assistance to people experiencing homelessness. Our programs include an emergency shelter, single adult supportive housing, and family supportive housing. And we strive to find affordable housing for all families. At any given time, we provide supportive housing to 100 individuals and 210 families with over 500 children. Unfortunately, there are more children experiencing homelessness in Minnesota than adults. At Simpson Housing, as an early childhood specialist, I go into the home and provide services centered around health and well-being, child development, parent education, and parenting support. The parents we serve are under extreme stress and experiencing trauma and are often focused on just getting through each day with their family. Our goal is to support parents through these intense times and provide them with the opportunity to focus on meeting the developmental needs of their children while we stabilize and help stabilize the family for long-term success. We know our program works. One of our former parents, I'll call her Cheryl, is evidence of that. Cheryl was a participant in our young parent programs and lived in one of our site-based apartment buildings. Cheryl is a victim of brutal domestic and sexual violence. I and other staff members actually saw her try to kill herself by running into ongoing traffic. She was trying to get herself run over by a car. Her boyfriend and the father of her child routinely abused her and used drugs profusely. Her son, who was very young when we first met him, experienced trauma to the point that he was not developing language. He used a guttural language and was extremely violent himself. He would have uncontrollable tantrums. We worked with both of them and made sure he had intervention through Frazier. It was a long road, but eventually things turned around for them. She is now a program manager at PPL, and her son is developmentally appropriate in behavior. He's learning and completely ready for kindergarten. HF 1226 provides flexibility to the Minnesota Department of Health to fund evidence-informed programs. Without these legislative changes, home visiting program like ours at Simpson Housing and other high evidence-informed programs may not be eligible to apply for state funding. We hope you will support FH 1226. Thank you.
Thank you very much. Members, are there questions for the testifiers? And not seeing any. Is there any member of the public who wishes to testify on House File 1226? Oh, yep, yeah, head on up, please. Oh, and we did have somebody signed up. My apologies, Linda Bell. I'm not sure if that's the person heading to the microphone now or if it's a different person, but and we can have, yeah, and really either way, I guess we'll have Ms. Bell go first, and then we'll have the other testifier and any other member of the public. And, if, and so please introduce yourself when you're ready, and please share your statement, share your thoughts.
Thank you. Good morning, Chair Pinto and committee members. My name is Linda Bell, for the record, Linda Bell. That should be an easy one to spell. And I represent Minnesota Advocates and Champions for Children. Home visiting in Minnesota has played a supportive role in helping women after the birth of their child. We're thankful to the visiting nurses and the many organizations here today who are doing very, very good work in this area. First, I'd like to thank the author for removing the 3-year requirement for new mothers. That in that way, mothers may choose to whether or not they wish to go forward with home visits. As the visiting nurses and others have said, 6 months might be enough, 2 visits might be enough if it's a little low-weight birth baby, but taking away the requirement, we appreciate that. All right, first, our organization has been working on data bills for the last 5 years here at the legislature. If you're newer this year, thank you, we're glad you're here, thank you for serving. And this has become an area of expertise for us. So in this case, expectant mothers, babies, and toddlers and early childhood data is also an important issue to us. Speaking of data, and though we are hearing today of many home visit organizations, Help Me Grow is an interagency organization working on behalf of the Department of Health and Education and is a referral service for home visits working in tandem with the public schools. Referrals are made directly to the Department of Education website via the Help Me Grow data portal. Following data input, the school district picks up the information, making the family contact and going forward with a home visit. Here's the catch and our concern. Parents may have no idea that their babies, toddlers, or children have been referred. Actually, parents may not even know or ever know that a data profile was created. Help Me Grow openly requires professionals to refer a child to the child's local school district if they, or, the statement is always or, it's not and, the child's parents are concerned about any aspect of the child's development. And of course, Help Me Grow is very much based on developmental milestones. That's much of what their website is about. And so the statement, again, I'll just read it to you. They have a section for families, they have sections for professionals, and these are going to be your doctors, your nurses, and so forth. As a professional, you must refer a child to the child's local school district if you or the child's parents are concerned about any aspect of a child's development. This statement, and there's more, it just says you may use the Help Me Grow system to make a referral. So this statement does not show mutual consultation, and it seems to be, there are other things on the website that show additionally the same sort of thing, the same sort of idea. In the end, data may have been entered into the system on the infant or toddler without ever offering parental notification or consent. MAC would encourage transparency at all levels of the referral system and to add a short opt-in statement or for consent before personal information is collected or shared. This catch-22 of data collection is invasive, especially when we know data can be used against you, profiling, in this case, an infant or a toddler, perhaps a mother or a family. Additionally, from testimony over the last 5 or 6 years, we know that the K-12 SLED, since we're talking about the early learning SLED, essentially, the K-12 SLEDs have not been audited in over 14 to 15 years. We're talking about here the third-party contracts that the K-12 SLEDs maintain, and this changes sometimes from year to year. And so they have not been audited. We really don't know what's going on with these third parties, that they are giving state information about our children to these 40 entities. And that, of course, is from the Office of Higher Education. Although that data is sanitized, data experts will tell us that this data could easily be reconstituted. Students are using the state student ID number, SSID number. That's also their lunch code number in the schools. All of that is sitting on the school district websites. It would be so easy to tie in a name and that SSID number. It wouldn't even take anybody that was very involved or knew very much about technology. They could hack into it. All right, secondly.
Ms. Bell, can I just ask a quick question?
Yes.
It seems like the bill doesn't relate to Help Me Grow, so I'm just trying to understand the connection.
This is the system that is at work,
Okay.
or part of
Thank
the
you.
system that is at work as we talk about home visits.
Thank you.
I have not a problem with home visits, okay? I'm talking about the system that's wrapped around. Just to give you another organization, essentially, is the BUILD initiative, which was brought in to help implement the Race to the Top Early Learning Challenge. And
Ms. Bell,
they also have a home visit portion, and so I'm going to talk about the home visit portion.
Okay, I was just because, what I ask if you can confine your testimony to the bill,
Yes,
to
all
home
right.
visiting and the bill, if you wouldn't mind.
So,
Thank you.
with the home visits, the BUILD initiative is pushing doctors to predictively diagnose students to put them into the home visit programs. Here, on one of their studies just brought out in 2014, it states, a mother brings her 6-month-old in for a checkup, and it's clear that the mom is stressed, poorly dressed, and shows little sign of responding to the child's cues for attention. While the child isn't diagnosable today, if things proceed as the primary health practitioner expects, in 2 years there will be significant indicators of development delay and likely social and emotional problems, including a DSM-4 diagnosis. And I can continue, but just to say, this is predictive diagnosis that the doctors are these are the ideas that are being promoted by some of the organizations that I believe the Minnesota legislature funds. This is predictive diagnosis, and it's just not something that we can really get behind. So, and then the next question there, of course, is this exploitation? Is this equity? Really? Is it equity, or is this actually exploitation? And this would mean that perhaps, not the bill so much, but how it is working in the system may not be what this bill and for whom it wishes to serve. Okay, you want to serve these people, but considering the system that's out there, in some parts, we could have some exploitation going on. In the end, this bill is missing protections for those organizations that are not asking for consent, and on the other end, doctors are being nudged to predictively diagnose children and babies and mothers. I would highly encourage protections to be included in the bill, data protections, and other protections that would maybe perhaps talk about predictive diagnoses where you're diagnosing a child 2, 3, 4 years ahead. Thank you very much.
Thank you. And the gentleman to your right, sir, you had want to provide a comment as well. Is that correct?
Yes.
Yeah, please identify yourself and provide your comment. And then we'll.
Thank you, Mr. Chairman. My name's Caleb Stromquist. I'm a constituent of District 1A. I'm from Roseau, so I drove always to come
welcome,
here.
welcome to you. Glad
Thank
you made
you.
it here safely.
Yeah, and I came down, and I'm not familiar with her that used to. I might move over.
As long as you're in front of a microphone, you're good.
This one's good.
Either one. Yep.
Anyway, I haven't done a whole lot of this either. So, but this kind of thing is pretty important. And anyway, the voluntary services for newborns, pregnant mothers, and children, voluntary services already do exist. If home visit bill is to create a means of informing families or directing them to those services, there are already, those services are available, and means of finding out about them are also readily available. They're posted in websites. They're oftentimes mailed directly to families already. They're in hospitals, doctors' offices, clinics, food banks, libraries, phone books, schools. Are home visits really about informing parents about available services? Or is this just a means of government getting a foot in the door? If this is a separate program, where is all the funding for a program like this coming from? That was covered a little bit. And what is the trade-off? It's a lot of money. Would it not ultimately come out of our own pockets, taxpayers' money? If this is a separate, if the trade-off giving over control of how we run our homes or raise our children to government-run agencies? Is inclusion in these programs going to include all kinds of undeclared prerequisites? Like was brought up, what is the requirements of some of these services and things? At the very least, we ought to be concerned about the data collection that we know will take place with this sort of program. And we should be concerned with how our personal data will be used. Similar types of programs are already collecting massive amounts of personal data on children and their families. The bill speaks of a type of scoring or rating system. It's an evidence-based bill and the program. So that speaks of collecting it. And it also must therefore be critically analyzed, resulting in the profiling of children, parents, and the family as a whole. If data collection isn't the main focus of home visit programs, then why would every state bill posted include this topic? We wonder if bill sponsors would consider adding opt-in consent and transparency clauses before personal information is collected and shared. I realize that it was mentioned that in the presentation and upon asking questions that requires consent, a parental consent for data collection, but that wording is not included in the bill. I would like to see that in the bill.
And Mr. Stromquist, I'm hoping to fit one more testifier in before we have to recess at 9:30. So if you could,
Okay.
if you wouldn't mind wrapping up.
I have a few more points to cover, and
If you could make them, if you cover them real quick.
Speed it up a little bit.
Real quickly, if you can,
Okay.
yeah, because I do want to fit somebody else in before we have to
Yes.
recess.
If data collection, so yeah, we wonder if you could include that directly. Personal property, personal rights, personal privacy. Your home is your property and should be protected against warrantless search and seizure. Your data should also be your property. Under federal law, PPRA surveys collecting students' personal beliefs on sensitive topics must have prior informed parental consent. Home visits and mental health screening should be no different. And the bill is very vague in regards to these crucial points. What if you refuse home visits? Will this turn into a big red flag that labels you as a risk? Still, ultimately, this is a government-run program, which is strongly inclined to be self-serving in very critical ways. I'm not as concerned with the bill, but how it will be implemented. Not done yet.
Well, Mr.
what
Stromquist,
if
I
you
kind of need you to be done very, very soon here, because I want to make sure, because I know other folks have driven long distance too, I want to make sure we can fit them in. So if you could wrap up.
What if you really can't say no? What if this home visit bill becomes mandatory? Gets changed like a similar voluntary bill did in the state of Washington. The Washington HB 1491, the Early Start Act, was changed in the legislative process. And the bill reads voluntary in some areas, but also removed the word voluntary in another area, resulting in it becoming voluntary. How will this kind of program impact our religious freedoms and freedoms we have to train and teach our children the way we as parents feel is right? I'm seeing a pattern behind those who promote this sort of top-down structure early education. I'm not speaking strictly in terms of home visits, but that structure. Whether for preschool 4s or birth to 3s or home visiting, the general idea that I'm getting from those behind programs like this and other essentially identical bills like First 1,000 Days is a mindset that children would be better off in a school setting away from their parents. It is not hard to draw a connection to any number of socialist, communist, and fascist governments who gathered in all the children while pushing off parents. And
Thank you, Mr.
those who fail to learn from history are condemned to repeat it.
Thank you, Mr. Stromquist. Thank you so much.
In closing,
You kind of need to close, Mr.
Just-
Stromquist. Yep, please.
These kinds of amendments would infringe on the rights we have long held as parents to make decisions regarding the health, protection, and education of our children. We need to ensure that these inalienable rights remain in the hands of parents, for we will surely not receive them back again once they are thus relinquished. I implore you as representatives not to vote in favor of any proposed amendment that would create or accept further incremental or expansive funding for home visiting, 4-year to preschool, or birth to 3 education through bill passage or acceptance of federal grants or in writing new grants.
Thank you.
Thank you.
Thank you, Mr. Stromquist, and my apologies for that. And Mr. Stromquist and members, we're going to have to be coming back to address this. I do want to make sure we fit in the additional testifier now. I want one more testifier now. But so if you wish to be addressing us further later, please feel free to, but I do want to make sure. And so please do identify yourself for the record, and please proceed. I want to make sure to fit you in now, so.
I'll be super fast.
So no, that's fine.
My name is Elizabeth Bankard. I'm the owner and director of Here We Grow Early Childhood Center. And even though my shirt says I'm a lobbyist, I'm not a paid lobbyist. The movement is about citizens taking their voices back. My concerns are with the delete all amendment, points 2.1 and 2.2, when we talk about health equity. When we talk about health equity, I feel like what we need to talk about is what this is actually about, and what this is actually about is human capital. And if you look at the World Bank, there's actually a 3-minute video, and this ties directly into my work of early childhood, because health equity and educational experiences starting from birth on are all part of human capital, which, as we all know, Art Rolnick is big on in this state. My concern is when you start assigning numbers to individuals, you start to determine what their worth is. And the mass amounts of data that Representative Franzen asked for and kind of was danced around for the 3rd time I've seen happen now in various committees, you have to ask where that data is going and who's going to own the data, and is the data being sold on a global market? And the answer is yes. The other issue that I take issue with is 2.15 and 2.17. You're expanding this money, our tax dollars, to go to nonprofit organizations. Mini Minds is a nonprofit organization, and initiative foundations actually are nonprofit organizations. Initiative foundations are listed as funding sources on the Mini Minds website, and the Mini Minds website lists home visiting as one of their main objectives. So our tax dollars are going to fund an initiative foundation, which is going to fund Mini Minds, which is driving the agenda. At least if I were to donate directly to a nonprofit, I'd get a tax credit. But clearly we're circumventing the system. And one has to ask yourself why the lobbyists, such as Close Gaps by 5, and other individuals who started programs such as Parent Aware, who make over $70,000 a year if you look to public records, are driving this along with our tax dollars. So I take a big issue with things that are coming to light, and that is, I feel, my job to bring them to light, because my tax dollars are funding my demise, and I'm not a fan.
Thank you. Thank you for your testimony. And for your persistence in being here and sharing your thoughts, and Mr. Stromquist too for his persistence. So members, we are done for now. What we've done is we've secured a room 200, I believe is the room. We'll recess to the call of the chair. I'm guessing that there's questions that folks have. I should look at all members, because perhaps there aren't any questions, and then we'd be done now and simply lay the bill over. Maybe we can do that. But am I correct? So actually, maybe I should ask that. First, were there anybody else in the public who had wanted to testify? I didn't think so. Maybe there is, no? And are there any questions from members? Because if there are, what we'll do is we'll recess and address those questions later. Oh, you do want to testify. I wonder. Okay, yeah, fine. No, let's do that. And so as you're walking up, I'll just ask members, did you have questions up to this point? I was kind of guessing that folks do, but perhaps they don't. Oh, I'm not seeing any from, oh yeah. Oh, yeah, there'll be a couple quick ones. Okay. Well, why don't you, ma'am, why don't you introduce yourself and begin your testimony or share your thoughts.
My name is Amanda Kowalski. It's AmandaKowalski. I am a stay-at-home mom to 4 children. I've had 2 hospital births and 2 home births. My first birth, I did have a home visit. It was something that I had requested. They had offered it to me in the hospital. And I was really honestly disappointed with the service that I received. The home visitor came, and the data collection really does take up a really large portion of time. I actually asked her like a half hour in if we were done yet, because I had my baby, I needed to feed her. I was really stressed out. What I really wanted was help with breastfeeding. And honestly, over half of the visit was a packet that I had to talk about with things I had already covered with my doctor about how I was feeling, and things like that. Things about my family, things about all those kinds of things. So in the future, I didn't request that service again, because when I got home, I didn't get it covered monetarily because I was not on MA, even though I could have been. I wasn't informed, honestly. My husband made, I think, $38,000 that year, and under the MA guidelines, I would have qualified as a pregnant woman, but I had no idea. So that birth cost me, I think, over $1,500 because I had good insurance, but it was a lot for us. And I didn't realize when they billed me that there would be a mother and a child bill. So they covered one but not the other. So I wound up with like another $110 bill that I hadn't planned on. But anyways, they didn't really help me. The nurse was not very skilled, I felt, with breastfeeding. Who really helped me was Leche League. And what I really wish would have happened was that I would have been informed of the programs that were there, and that program just was useless. So when I'm sitting here listening to you talk about these women in really stressful situations, and picturing a government employee essentially coming in and asking them, or, you know, an extension of the government that's gonna report back to fill out a packet that's gonna take you a half an hour, and then have them look at to see if, you know, there's plugs in your outlets and if your crib sheet is fitted on right and stuff. It feels more like a test to me than a help. So that's just my perspective. Thank you.
Ms. Kowalski, thank you for sharing your experience with us. That's really helpful. Thank you. So maybe I'll just clarify, Representative Bonner, that this is entirely voluntary. There's no registration or referral or connection with schools, as far as I know, or with Help Me Grow. And I'm seeing you nodding and agreeing with that. Okay.
That is correct, Mr. Chair.
Okay. But, and Representative Franson is just making the point. I want to make sure it gets recorded from Representative.
Well, I'm just saying the nonprofits that aren't listed in here, so we wouldn't know if Here We Grow or these Help Me Grow is even part of it because it's not listed in the bill yet. So we won't know until after the grants are awarded.
Representative Franson is saying that Help Me Grow, we wouldn't know, but I think Help Me Grow, it wouldn't be a program that would apply for a grant to do home visiting. It's sort of a totally separate thing, is my understanding. So are there any other questions from members? Because we may not then have to come back at this point. But remember, and reminding everyone, both members and members of the audience. Oh, Representative Heitzman does have something.
Representative Heitzman's going to have a number of questions.
Okay, I kind of thought, okay, good, Representative Heitzman. I kind of assumed so. So, okay. So then in that case, members, what we're going to do is we're going to recess to room 200. It'll be to the call of the chair. It'll be at some point after session. And then a reminder for, I guess, especially members of the public, that the bill will be laid over for possible inclusion in the division report that'll go to the HHS committee. But I think it's important we explore the issues that were raised, and Representative Heitzman will have some questions, maybe others as well. So with that, members, we are recessing to the call of
Mr. Chair, hang on.
Pardon me?
I think that I can get my questions answered offline.
Representative Heitzman says he thinks he can get his questions answered offline. It's and Representative Heitzman, don't feel any, I mean, we can do it relatively briefly after session 2, so I don't want you to feel any pressure. There certainly were important issues raised, and this will be an ongoing conversation as well, of course, but feel very free. Representative Heitzman, up to you.
I misunderstood. We'll go ahead and come back.
Okay, we will come back. Okay, so we're going to recess to the call of the chair. Thank you, members, and many thanks to members of the public as well, and Ms. Reckinger.